Hello everyone, I'm Dr. Mosen. Today we are kicking off the first episode of Psych Minutes by delving into the relationship between cannabis or marijuana and anxiety. I frequently encounter patients who inquire whether cannabis might alleviate their anxiety, or they may already be using it as a coping mechanism. But does cannabis truly provide relief for anxiety in the long term? Firstly, I will delve into the available evidence for those interested in more details. Towards the end of this episode, I will provide a simplified summary to address this question, and I will offer some recommendations. I've selected two recent systematic review meta-analysis articles. You can find both references in the caption or first comment. The first review, published in 2024, synthesized evidence from 18 individual studies encompassing approximately 35,000 adolescents and young adults followed over several years. These individuals, initially mentally healthy, were compared based on cannabis use. Out of 18 studies, 14 reported a significant increase in anxiety among cannabis users compared to non-users, while 4 studies found no difference. Interestingly, none of the studies suggested that cannabis improved anxiety in the long term. Employing advanced statistical techniques to combine a subset of these studies, the researchers determined that cannabis use doubled the odds of subsequently developing anxiety disorders. The review article followed recommended international guidelines, employed a specific selection criteria to mitigate bias. While the majority of those 18 individual studies were reported to have acceptable quality, it's noteworthy that, in my opinion, their quality assessment was insufficient. The second review, published in 2021 by a different research group, adopted a relatively similar methodology. Out of 24 studies encompassing a total of 50,000 individuals across different age groups, 10 studies reported increased anxiety in cannabis users, 12 studies found no difference, and in 2 studies, anxiety improved as cannabis use decreased. Similar to the first review, no evidence emerged indicating that cannabis alleviates anxiety in the long term. The review article did adhere relatively well to the recommended international guidelines. However, in my opinion, their inclusion criteria were not restrictive enough, and the quality assessment was conducted only for a subset of the included studies. Overall, I concur with the conclusions drawn by the authors of both articles, which suggests that there is substantial evidence indicating that long-term cannabis use may exacerbate anxiety, especially among adolescents and young adults whose brains are still in development. Conversely, there is no evidence to support the notion that cannabis alleviates anxiety in the long term. So why some individuals feel that cannabis helps with their anxiety? Are there differences between cannabis strains? What about cannabidiol or CBD? I'll address these questions in the next episode of Psych Minutes. In the meantime, if you're experiencing nervousness or anxiety, I encourage you to speak with your primary care doctor or mental health provider. There are several techniques and relatively safe medication options with proven efficacy to help manage anxiety. Stay safe and stay tuned until the next episode.